My name is Jeremy Daniel. I am an associate professor of pharmacy practice with the South Dakota State University College of Pharmacy and Allied Health Professions. I'm also an adjunct clinical associate professor of psychiatry with the USD, Sanford School of Medicine, and a psychiatric clinical pharmacist at Avera Behavioral Health Hospital down in Sioux Falls, South Dakota. I've been with SDSU for about 8 years. I'm specializing within mental health and as a role of a co-researcher within CPIC. So my past research really spans the breadth of mental health. I've worked on a chapter in a book for psychiatric pharmacy recertification on bipolar disorder, as well as written an article on pharmacogenomics and personalized medicine for the treatment of mental health patients. And lastly, even written an article on psilocybin, which is the ingredient in magic mushrooms for the treatment of a various number of mental health disorders. So one of my current projects that I'm working on, it actually involves 2 HRSA grants for the treatment of opioid use disorder and stimulant use disorder in the state of South Dakota. We're working on how to improve outcomes for our stimulant use disorder and opioid use disorder patients here in the state through some medication related treatments as well as medication related treatments. One of my current research interests is really to help community pharmacists and pharmacists across the state of South Dakota have a little less stigma with regard to mental health disorders. And so one of my dreams is to develop a sort of psychiatry boot camp for our pharmacists here in the state to help them reduce their stigma, but also be comfortable being some of our first line healthcare providers in the rural state of South Dakota. I think as we talk about CPIC as a resource, going back to that development of that psychiatry boot camp, I think CPIC with this development of training and certifications can really help with that. There are a lot of resources within that particular center that we can leverage to make it more of a statewide initiative with a number of researchers across the state.